is Tiffany Canipe. I'm a patient services navigator for Banner MD Anderson Cancer Center, and I am based out of Glendale, Arizona. So I've always had a passion for helping others. Prior to coming into the healthcare field, I was actually an elementary school teacher for many, many years. So I've always had a servant's heart. I love helping others and making sure that they're taken care of and their needs are met. And I have actually been with Banner. Next year will be 3 years. I started with being a healthcare scheduler for Banner MD Anderson, scheduling oncology initial consults, hematology, genetic testing, and actually transitioned into this role in April, and Azra went live in our queues in June. What motivates me daily is definitely my team and my leadership. They are rock stars. I cannot say enough positive things about them. They are super supportive, and we are constantly meeting together to review questions, support one another. I would also say the biggest thing is when I get to speak to a patient and I get to hear a little bit about their background as we're scheduling their appointments. And once you get to know them, it's like talking to your friend. And so you want to make sure that your friend is taken care of. So recently I helped a patient. She disclosed to me early on that she had anxiety. And when I first spoke to her, she really wanted to follow up with her primary care in person. Even though they'd had a discussion over the phone, she shared with me, I really need to go see my primary in person. Would you mind following up with me after that appointment? I was more than willing to do that. I completely understand where she was coming from. I wanted her to be comfortable and feel willing to do the appointment, not wanting to feel like I was forcing her to do the appointment. And it's funny, as we had a scheduled time, she's like, call me on this day at this time. She called me 45 minutes before that scheduled time, and she's ready to schedule now. And so we got her scheduled. She continued to follow up with me, and recently she actually asked if she could speak to my supervisor, and I got the voicemail that she left my supervisor, and that was such an impactful moment for me, because in the message she tells my leader, Tiffany takes care of me, and I have severe anxiety, and whenever I speak to her, she calms me down. And it was in that moment that I was like, this is why I do this, because I want the patient to feel comfortable with me and know that they're in good hands and that they are going to get the care that they need. So we see patients that either their providers have sent them over to our imaging facilities for follow-up for various diagnosis or findings that they found, but we also get imaging that goes through the ED in live time. So those patients could be foreseeing a lack of care. They don't have an established primary care. They don't have a specialist that they're seeing. They don't have health insurance at all. They may be homeless. So in those situations, it's providing the resources, the point of contact for those that don't have the health insurance. Maybe we can introduce them to somebody within, whether the ED that they were at or within our facilities, that can assist them with that. They might not even have transportation, so we might be able to assist them in working with their insurance or other resources to get them to the appointments. Another one that I see quite frequently are patients that live quite a distance from our facilities. They still live in the state, but they do live quite a ways from the facilities, and our providers can actually see them via telehealth. In this position, when I'm scheduling these patients for their appointments, and they'll state to me, oh, I have so many questions to ask the provider when I get there. And it's in that moment that I'll say, well, why don't you start jotting those questions down, whether it be putting it in your phone, starting an email, writing it on paper. I'll tell them, like, I've even had where I've stopped, scheduling for a moment. I'm like, why don't we take a minute? You can write those down. Those are great questions to bring with you. And the patient's so appreciative for that. And I'll also reiterate to them that our facilities will allow 2 guests to come with them. And I'm like, it's great to have an extra pair of ears at the appointment, or even, have the other guests maybe take some notes for you. So if you missed something that maybe you didn't hear, or maybe they overheard that you didn't, but it's also nice to reiterate to the patient, educate them that they are their own advocate. Ask questions. Take the opportunity to listen to those around you, because each interaction is an opportunity to learn and to grow from that individual's personal experience and knowledge. Just being in my position, I've learned a great deal just from my teammates, whether it be an MA, a nurse, a provider. I've even reaching out to the financial services representatives or the schedulers. Their knowledge is overwhelming, and everybody's experience is so wide range that I love it that when I reach out to individuals, I end up with new resources for my patients, new answers that I wasn't even aware of. And it's just constantly asking those questions, creating your network. Technology is absolutely vital in the role of oncology care, from just the text messages and the email reminders for upcoming appointments that patients have, to obtaining the outside records and being able to communicate with outside providers and facilities. I mean, you additionally have, if you think about the equipment that we utilize to do the imaging scans, conducting various procedures, and even down to Azra being utilized to identify the high-risk criteria in imaging reports. It is so vital and a key factor to oncology care. I prioritize myself so that I can show up for my patients. First and foremost, it's my team. I love having a team and my leadership that I know at the drop of a hat, if I had a question, I can ask and I'm got an answer within seconds. And it's because of them that I can unplug at the end of the day, leave work at the desk, and go be mom. Mom is my favorite job. That is where I rebound back from, some of the situations that we see on a daily basis, whether it's just going out and getting to watch my daughter Caitlin pour her heart out on the soccer field as a goalie, watching my son Zane rock it out playing the piano and the drums, or just going thrifting with my oldest daughter Haley and hearing about how she's navigating through adulting life now. Thank you so much. I greatly appreciate it. It's been an honor.